I was wondering when you're talking about that, because I know the urinary incontinence tends to impact older people. Is it part of the aging process, though, that the muscles become maybe weaker? Or is that just a normal progression when you age to a certain degree? Or
Yeah, I hate to think of it as a normal progression because I
okay,
feel like sometimes that implies that it's okay. But age is definitely a big risk factor. As we age, our muscles aren't quite what they used to be. And it's definitely more prevalent in older patients. They estimate, I guess 45 isn't that old, but in women
no,
greater than 45, some large survey they did of over 5,000 women showed that about 1 in 5 women
wow,
over the age of 45 have this
have that
problem.
issue. Well, you mentioned at the beginning of the show you think it's underdiagnosed, and we were talking before the program that we thought maybe I had read some information suggesting that it was more prevalent among women, but you think that maybe it's just that women are seeking the treatment, and maybe there are more men who actually have the issue, but they're maybe not wanting to look into it or have it treated.
Historically, we used to think that being female was a risk factor because we thought it affected women more. And we definitely do see more women seeking care, but they did do some studies more recently that suggest that actually men also have this issue too, but perhaps are just not seeking the care for it.
Well, like you mentioned, there's the social stigma, unfortunately.